This is the single biggest mistake you can make in patients with an acute traumatic brain injury. We've always been taught that a MAP greater than 65 is appropriate for most patients, right? Especially your septic or your shock patients. But what if I told you that in traumatic brain injuries, you actually want their pressure to be a lot higher than that? See, a MAP of 65 is great to perfuse your organs, right? Like your kidneys, your liver, all that. But in the brain that's having some swelling going on, there's actually a little bit of pushback that's lowering that MAP artificially. The number that really matters is something called cerebral perfusion pressure. And think of it this way. Your MAP is the pressure pushing blood into your brain, but your swelling or your ICP is the pressure pushing it back against your MAP, leaving a final number called the CPP. CPP is just MAP minus ICP. A CPP of less than 60 is shown to cause worse outcomes for these patients. That causes more ischemia and it just doesn't help them. You want to target a MAP of like 80 to 100, thus you give yourself a little bit of wiggle room, especially if that ICP is starting to climb as high as you think it is. And that's why it's important that you don't just target a MAP of 65. You want to take into account the ICP pushing back against it.